Hi, my name is Natalie DeJuste, and I am presenting on behalf of Dr. Brooke Dorsey-Holloman and myself. Dr. Brooke Dorsey-Holloman is the principal investigator of this project and associate professor for the Department of Family Medicine, and also the director of the Qualitative and Mixed Methods Core at Accords at the University of Colorado School of Medicine. I am co-investigator and project manager at the university for this project at the University of Colorado Anschutz Medical Campus, and a clinical psychology PhD student at the University of Denver, and a National Science Foundation graduate research fellow. The formal title of this project is Enhancing Black Maternal Birth Outcomes Research by Advancing Community Engagement, or EMBRACE. This work is funded through PCORI. The vision of PCORI is that patients and the public have the information that they need to make decisions that reflect their desired health care outcomes. And the mission is that PCORI helps people make informed healthcare decisions and improves healthcare delivery and outcomes by producing and promoting high integrity, evidence-based information that comes from research guided by patients, caregivers, and the broader healthcare community. This work is funded through a community engagement capacity building award, the goals of which are to equip patients and other stakeholders with the skills necessary to participate in comparative effectiveness research as partners throughout the research process, and to develop infrastructure and partnerships for disseminating and implementing PCORI-funded research findings, and to scale up or adopt meaningful engagement tools and resources with communities, stakeholders, and patients with the intent to further build capacity for patient-centered outcomes research and comparative effectiveness research. A brief overview on Black maternal health. Black birthing people are 3.4 times more likely to experience pregnancy-related mortality and bear the greatest burden of pregnancy-related complications. In Colorado, 5% of births are to Black birthing people, but they account for nearly 10% of maternal deaths. And half of all pregnancy-related severe morbidity and mortality incidents are preventable. So this project seeks to increase the capacity of community partners and researchers to conduct patient-centered outcomes research. Our aim is to develop a sustainable Black Maternal Research Coalition, or BMRC, in collaboration with community partners. And we hope to identify and prioritize maternal health issues important to the Black birthing community and community partners to lay the foundation for conducting patient-centered outcomes research in this research area. So again, just to go over our objectives, our goals are to develop a sustainable, collaborative, and culturally informed BMRC to engage in maternal health outcomes research as it relates to Black women and birthing people in the Denver area. We hope to identify maternal health patient-centered outcomes research priorities from the perspective of Black women and birthing people, community stakeholders, and providers. And we also aim to create infrastructure for the dissemination of maternal health research findings among Black women and birthing people and stakeholders in the community. At the core of this work is, of course, going to be community-based participatory research. 5 kind of key tenets of community-based participatory research include that it is a collaborative approach that involves all partners in the research process. It also aims to eliminate disparities and improve communities, aims to identify research topics of importance to the community, and recognizes the unique strengths of each partner. For our work, for us, we identified 3 key areas for community engagement. First, we had a community advisory board, which consisted of activists, psychologists, medical providers, residents, Black women, and Black birth workers. We also identified community leaders, which included organizational leaders, community-centered directors, birth worker collectives, advocacy groups, and other health organizations locally. And at the core of this work was the BMRC, or the Black Maternal Research Coalition. And so the remainder of this work is really, or of this presentation is going to focus on the conduct and the findings from the focus group and listening sessions that we conducted with the Black Maternal Research Coalition. So with our advisory board, we developed a focus group interview guide. And for the focus groups, the facilitators were Bentley Porterfield-Finn, who was a member of our advisory board and a community-based research consultant for this project. And she is a birth worker or a doula, myself, and Dr. Brooke Dorsey-Holloman. So for the focus groups, we conducted 2 focus group sessions on April 9th and April 30th. We had quite a bit of interest to participate in the focus groups. On day ofs, we had a total of 17 attendees participate in the focus groups. Those people were identified as or included Black birthing people, people identified as women or non-binary, and we also had many birth workers who participated as well. For compensation, we did want to compensate everyone for their time, and so each participant was offered 2 gift cards. Either they could choose from Amazon or Target, and they were and those were for $55 each, and then a $25 DoorDash gift card to treat themselves to lunch for the day. And so the focus group participants identified 5 key research priorities. First was a need for research that examines patient-provider communication, the exchange and appraisal of reliable maternal health information, and education. Also identified a need for longitudinal research that connects birthing parent health to infant health outcomes. Additionally, the need for research that focuses on Black perinatal mental health was especially highlighted. And then relatedly, research that looked at mental health outcomes in relation to experiences of infertility or pregnancy and infant loss within the Black community. And then more research that examines the benefits and applications of group perinatal care interventions in Denver. Within each of these domains, participants identified 3 key domains that they wished to see explored through research, again, within these research priorities. And so those were trauma-informed care, looking at racial trauma and racial bias, and then also intersectionality of Black birthing health, intersectionality with Black birthing health outcomes. And so basically looking at how being potentially, how having disabilities or being lesbian, gay, bi, queer, or transgender, or gender expansive potentially intersects or different, how that might relate to Black birthing outcomes. And again, as well as looking at how the intersection of disabilities and Black birthing outcomes. And so what's next? So we aim to develop the infrastructure to disseminate these research priorities within our community. And then we also hope to continue to engage and work with our community partners and grow our network to build capacity to conduct meaningful research in the areas that were specifically identified in the focus groups from our participants.